Hey, Mike.
Hey, special needs cats and dogs. A joy or a burden?
Oh, I don't know.
Let's discuss this with Tracey Turnbull. She knows a lot about the subject.
Okay, great.
Hi, I'm Mike Brampton.
And my name is Julian Ho.
Welcome to Veterinary Ramblings.
Welcome, Tracey.
Hello, Tracey.
Hello, hi.
Your friend Louise Buckley dobbed you into this, didn't she?
She did, Louise, bless her, yes, who came to my rescue when, very sadly, we were one of the first charities affected by a positive Brucella test, the Canis test. And yes, it was a very difficult and challenging time. She very kindly gave us advice and support and information and a lot of scientific literature to read.
It's a quagmire, isn't it, this Brucella business? And I think it was very badly handled at the start. Hopefully there's a bit more sense going on with it.
What's happening in the world now, then?
I'll pass the question on to Tracey. What's happening with
I
your...
think that it's almost from the veterinary side, it appears that obviously we're following that on the forums, though I'm not obviously qualified in anything to do with veterinary medicine. There are more scientific and evidence-based algorithms for care and treatment of dogs who are testing positive, and also a different approach to the testing per se, and with some more realistic guidance for vets and veterinary nurses and veterinary professionals about when to test, what tests to use, how to interpret them, what the implications are in terms of human infection and the risks that may or may not be important to those individuals. I think after the hares, but the most recent hares report was published in September. Now the prevalence of the diseases appears to be more well documented, and they are starting to recognise the risk as being very low to low. They had enough to make a kind of fairly clear statement on what they believed should be the priorities going forward. And they also, for the evidence gaps, we're better equipped to start to research where the gaps are.
Has that affected the charity on the ground now? Because there was holding of veterinary services, there was talk of routine euthanasia. It was all very emotive and very extreme at one point. What's the situation now if your dog tests positive for Brucella Canis?
Well, there are still going to be limitations for that dog, I think, and whether that will change over time, possibly. But the recommendation is really that the dog, where possible, is limited to the domestic environment that they live in, or can be walked in an area where no other dogs or people frequent that area. So if you have land, private land that you can access, you can walk the dog there. If they urinate or defecate, that you have disinfectant and that you use that you don't let them come into contact still with people who are high risk, so immunocompromised or elderly, very young. The truth is we don't know, because there haven't been enough documented cases to really understand where the disease severity is going to be greatest. But we know that for virtually everybody, the risk is going to be very low for most people. But I think that now most vets probably, hopefully, will not be citing euthanasia as the only solution, and that they would be talking to owners about how they could manage their dog and the implications going forward. For the charities, obviously, you would hope that all reputable charities are now testing pre-import.
I was going to say, that's the critical thing, I think, isn't it? It's the pre-import. And a lot of charities are struggling for money all over the world. We have the impression that the charities in Romania, where I believe Brucella is believed to be rather more rife, are struggling even more than some of the other countries. So how are we able to ensure that they can finance testing?
It's very difficult at a time when charities, not just animal charities or overseas rescue charities, but all charities in the UK are being badly hit by the financial crisis, and fundraising is an ongoing problem. I'm more involved with rescuing dogs from Greece. However, the charity has rescued dogs from Romania and other countries. The actual cost now of importing a dog from overseas, from the start of preparing that dog to getting into the UK, probably around about £1,000. You're not going to get much change out of that. And your blood testing of that, if you're going to test for your general 4D tests and Canis, then you're looking at €150 probably. And then, of course, you've got your courtesy of Brexit, you've got your import tax and your customs duties and preparing the animal health certificate, and then your transport costs for moving the dog to the UK. Many charities will use a registered facility before the dog comes to the UK, and then again when the dog is in the UK. So, for example, our charity, it's an association of dogs and cats owned member. So we have to have our dogs independently behaviourally assessed before they can be rehomed. So they have to go to kennels first to have that carried out. But for people to say that most charities are making money out of importing dogs, we lose money. We lose money very successfully. If you can show me any who are making money, tell me. Because we're not.
I know, I can't believe. Do the new owners, fosterers or adopters, cover most of those charges, some of those charges? Do they vary greatly?
It probably about 2/3 of that are covered by the adoption if it's a young, healthy animal. If it's an older dog, and some of the other charities are important cats as well, but some of the older dogs or dogs that have special needs, there would be usually a low adoption fee, and the rest of the cost of bringing the dog into the country would be met by sponsorship, either individually or on a corporate level by the charity or by fundraising for a specific dog. And there are lots of fundraising groups that will help some of the charities with particular dogs if we make it known to them, look, we've been asked to help this dog. The reality is we're only going to be able to ask a very low donation fee because there are ongoing costs with that dog. Then recently this dog came over, he's 11, and of course they may have had a very hard life. You don't know how much longer they're going to have, and so you can be unreasonable and unfair to ask an adopter to pay a huge amount of that. Although some do, some will offer to pay.
Tracey, what do you mean by special needs dogs?
Any dog that has a health or well-being need that is over and above what you would normally expect. But in real terms, what does that translate to for most rescue dogs coming over? It would be blind dogs, deaf dogs, dogs missing a limb, paralysed dogs. But of course, dogs with epilepsy, dogs with lupus, dogs with ongoing skin conditions. It encompasses a huge number of different disorders. But personally, my involvement has been mostly dogs with orthopedic issues or particularly missing limbs.
What got you into this?
I stupidly adopted a puppy who had been run over by a car and left for dead on the side of the road in Greece. And I saw a promotion on Facebook for her, and nobody else wanted her or would adopt her. And so I did, and it was, completely terrifying and anxiety-provoking. I didn't know what on earth I was doing. I was a nurse, and I made a huge number of mistakes because I treated her as if she was an invalid, when in fact she's just a normal dog. And I created a monster, an empress who kind of rules the house.
That was brilliant.
Yeah.
So dogs and cats often cope much better than we would with similar injuries or similar special needs. I think because they don't know, do they? They don't know that there's anything else they should be doing about it.
No, they have the experts, kind of mindfulness. They live in the moment. They have no sense of body image. They adapt. They're resilient. They're
like the Black Knight from Monty Python, aren't they? They lose an arm. Come on.
Yes, come on.
Come on back.
I'll bite my way along. Exactly, and that's what they teach you as well. I think that having a pet with special needs it's a huge undertaking, but it's a huge privilege as well. And I think you learn things about yourself, and those around you learn as well. But particularly my grandchildren, they have the opportunity to question disability, to look at it in a different way. And I think that has real advantages in terms of their emotional growth and empathy and understanding that, just because somebody or a dog is different, it doesn't mean that they're not still a dog and they don't still have the same feelings, needs, wants.
What have you learned from the experience?
I guess I've learned that some of the things I thought were important in life are not. I think I maybe learned that lesson when I was young, because I nearly died in a car accident. I was in hospital thinking, I'm never going to spend another day in bed. I'm never going to lay it. Every day I'm going to enjoy life. I'm going to live life. I'm going to grasp it. And of course, that not every day I haven't, but generally speaking, I have tried to always think that this life is a gift. And I think in my job, you're acutely aware that it can change in the blink of an eye. And I think that disability is a club any of us can join any day, any time. It can happen. And you don't necessarily expect it's going to, or be prepared for it. Nevertheless, it can be visited on any of us. And I think that I've really learned what is important in life, and to try and not take things for granted, and that we can adapt, that we can all adapt, and you don't have to fear something just because it's an unknown. And I think in my job, that's been really helpful. I've learned lessons from the dogs that I've taken into my work with people. And I guess that's that one health, isn't it? We're all learning.
Yeah. Yeah, that's true. Do you want to tell us a little bit more about your road accident?
Yeah, no, it's fine. I used to run for the county cross country running, and I was out running training, and it was dusky. It was in the winter, and I was running down the road, and a driver he was on the wrong side of the road, so he ran me over, and I sustained some quite serious injuries. Fractured femur, which was a really, really very, very difficult fracture. It was in many places, and it couldn't be pinned. And I had lots of other kind of lesser injuries, pelvic injuries, and it had to be in traction for the bone to just heal on its own. It couldn't be pinned, it couldn't be plated. It was too convoluted because they didn't want to amputate. I was so young. Then that was a kind of a long journey of rehabilitation after that as well. And then sadly, I kind of fell over and refractured it again. I kind of went back a bit, and but anyway, I'd say I got through it. And although I missed a year of school, I caught up and carried on, and again, just showing that you can get away with quite a bit.
So you were 13 when that happened, yeah? And that's you've credited this with, in effect, changing the course of your life.
I think you really did, because the people who looked after me in hospital, I was very lucky. I was actually put in an adult ward because I was on the cusp of whether I should be in a children's ward or an adult ward. So I was put in an adult ward, and I think that the nurses felt sorry for me, probably because I was still very young, and I did get very well looked after and very well treated. And I think that not just my physical needs, but my psychological needs were very well looked after by the staff there, and I genuinely felt cared for and nurtured at a time when I still you still need your parents as well. And of course they couldn't be there. They visited me every day, but they couldn't be there. And I remember thinking, I'm going to do this. I am going to pay back what I've had. And I don't know that my school were particularly happy about it. At that time, it wasn't a degree level course. When I started, you're going back 40 years ago. This was a certificate level course then. And, they didn't expect you to leave with all your A levels and then go off and do nursing. But it's been a good life for me, and a very rewarding career. And I still love it. I still enjoy it.
What did these other forces think that you were destined for then?
I had a place to read law, so I think they probably would have preferred me to. For those of us who didn't go to university, we were kind of lumped at the back of the prize giving.
It was very different in our day, wasn't it, back then? And obviously, people like his nibs over there, he knew he wanted to be a vet and a biochemist and all of this sort of stuff. And we were expected to follow this path, weren't we? And I can still remember the careers advisors that would come around school and they'd give you this. Can you remember those interviews where you had to go through a whole list and then they'd go, yes, okay, Mr. Brampton, I think that's perfectly right. And yes, you should become a fighter pilot.
We have
apart from that, there's enough clowns in the circus as it is. So
we had this crazy Polish guy called Mr. Radovich, who I'm sure is long dead, poor chap. But he hated the thought of me becoming a vet. He said, why do you want to be a vet? This horrible job. There's poo everywhere and smells. And you get bit, you know that? You get bit and kicked and bloody shitty job. You become an actuary. You're good at math. You're actuary. That's the thing for you. You get loads of money and you buy cars and have big expensive wife and house and things. And he was always an actuary. You get lots of money. But vet, no. And to the day I filled in my UCA form that we had to do at those days, the university application form. Oh no, you're fool! I wash my hands. Wash my hands.
It was pretty much the same. Yes, you wash your bed pads. Is that what you've studied for the last 5 years to do that? It's been a great career.
and an incredibly illustrious career. So you were a nurse for how long?
I'm still a nurse, so I'm like trained in 83 as a clinician. In nursing, there's a real push in terms of promotion to go into management. It's much easier to acquire status and more financial reward than going down the management. For those of us who choose to be clinicians, it's frowned upon, even in the nursing. That is changing. And obviously the nurse consultants and the nurse specialists now, that's changing. But I first of all trained as a general nurse and then worked for a while in general nursing, A&E and neurology, and then thought, I don't really, it's a bit like having a car and kind of the car's running, but you don't really understand the engine. And I kind of thought, well, I really want to understand people more. So I thought I'd go and do my mental health nursing. So I did that, then went back to general, kind of worked for a while back in general again, and then transitioned over to psychiatry. But the job I have now encompasses both in a way, because I work with as a clinical lead, but I triage all the calls coming in. So for the junior doctors who are on call with me, the call doesn't go to them, it comes to me first, and then I assess whether I can deal with it, the staff can deal with it, just giving them support. And so I get to deal with physical and kind of mental health, trivia and emergencies, everything really. And it's a very reactive job. I'm everybody's manager and nobody's manager in a way, just there to make sure that everyone gets through the night, hopefully, and we all come out the other side.
Interesting. So what sort of calls do you get?
The mundane stuff is bed management. That's you're always going to try to make enough beds to bring in the urgent admissions. Deteriorating patients, particularly patients who have physical deterioration of their physical health. Patients who have infections, septicemia, this kind of stuff. Psychiatric emergencies, challenging behaviour, patients who are requiring their medication titrating or making decisions about what course of treatment they should have. I'm based in the hospital, so I'm the kind of fire warden for the building, and I'm the security manager for the building, and also doing clinical supervision and appraisal. So it's a really wide repertoire of different types. It's really interesting. I think I'd get bored if I was in a job that wasn't quite diverse. I think I'd get bored quite quickly. But there's always something every night. You never know what you're walking into. It's never the same. There are 2 general hospitals that kind of feed into our service as well. And then we get calls from the police and the ambulance service if they go out to somebody and they have a kind of mental health query or emergency, or they want advice.
Did I hear that the police are now no longer answering mental health calls?
In some areas, the Metropolitan Police said that they were withdrawing. I mean, certainly where I work, we work quite closely with the police to try and signpost the appropriate route for anybody who is presenting with an acute mental health problem. And we have a practitioner who goes out actually in the patrol cars and will go and give hands-on kind of advice and support. And they'll ring me, for example, if they feel somebody needs assessing admission. But it does vary. It's a bit of a scope difference depending on where you live.
I was wondering if you ever got the call and you had to go racing off in the blue lights with the police officers. And
there's someone doing that, thankfully. But I'll be opening the door to
them. Or
if
your husband drops you off in a plane.
Yes. Yeah.
So mental ill health is getting a lot more press than money, I think it's fair enough to say, isn't it? I read a report today that the average waiting time for treatment with someone with ADHD is up to 10 years. In other words, that they're never going to get treated. Mental unwellness, mental ill health among the under 12s is up around 40%, isn't it? Year on year. And there just isn't the expertise, there isn't the money to deal with that. Do you see that getting better?
I think the umbrella of that mental health services encompasses is growing and growing all the time. And I think that it's very difficult when you are prioritizing, because there's always going to be a limit to resources. It's unrealistic to think that there's going to be unlimited resources. And I guess that's where the CQC and NICE and commissioners are trying to work together to really look, where do we need to target in terms to make the best use of the resources, the skills, the money that's available. And in the same way that in physical health, that techniques are changing all the time. Scientific advancements are being made. Medications are changing. The targeted gene therapies and all this. These things are hundreds of thousands of pounds. And what price do you put on a life? And I guess in mental health services, it's what degree of incapacity or disability. Where do you choose to target the money that you have available and the staffing that you have available, because it's not unlimited, of course. We have a huge number of vacancies throughout nationally. If you look, I don't know what the current kind of vacancy factor is, but it'll be huge because everywhere is running with vacancies. And we recruit from overseas. We recruit continually, looking at how many staff we're training, and of course we're doing other schemes out. So we have the nursing associates and just a different route to registration. But I don't know all the answers, and I don't think anybody does. And I think that what do you even class as, where does mental illness start? Where's the continuum? Where do you want to draw your parameters on that?
I was chatting to someone about it earlier on today, in fact, who said, I don't think there's any more mental ill health among children. It's just that the fleet generation, we used to just get on with things. Actually, no. I don't think that is the case at all. But as you say, there's a continuum, and it's those at the perhaps the lower end of that continuum that could get on with things and get better. But we just don't know enough about those individuals and about the best way of caring for them to see if that is the best way of doing it in modern society, because life has changed so much since we were kids.
I think sometimes it's helpful to go back to basics sometimes, I think, and think, it's like Maslow, isn't it? What are your building blocks? Are you getting enough sleep, exercise, the right diet? What are the stresses in your life that you can address, that you can do something about? Because some we can't, they're just over and above our control, but some things you can. And I think, again, for children, what is it that is causing them distress, or how would they describe their concerns or their issues? What do they feel they need support with? Because it might be quite different from what we perceive their needs are. And I think some of the therapies, the what we call the brief therapies, the brief interventions, which are solution focused, are really putting the person at the heart of, and saying they are the expert on their life. Even if they're a child, they probably have a good idea of what they think are their issues and what they might be able to start to do about them. And it's giving them that reflective time and opportunity to explore that. That's the important thing in a therapeutic relationship. So you have all your psychological therapies going right up to where your patients are very psychotic and need to be in hospital because they're a clear risk to themselves or others, usually themselves, and much more awareness, I suppose, of self-help and CBT, meditation, all of these things that will have a part to play in wellness.
Sure.
You like asking difficult questions, don't you, Tracey? Or posing difficult questions, because I see here that you got yourself into biomedical ethics.
Yeah, I think that when you study ethics, then you end up with more questions than you ever have answers to. And even within philosophy, and there are so many different schools of thought, and you can look at a problem from a whole different array of different perspectives and come up with different answers, and none of them are wrong necessarily, or right. But I think that sometimes it's really helpful to have that discourse, because that's what allows you to explore what the options are. And sometimes there is no right and wrong, is there? In life, there is no right and wrong. And certainly in medicine, there can be more and more onus to practice defensively and to perhaps, and I'm sure this is true in veterinary medicine too, because I think this is what's coloured some of the approach to B. canis, I think, is it's almost become sometimes a bit of a medico-legal hand-holding exercise, when in reality, what we should be doing is we have a challenge. How can we meet that challenge?
We sometimes veer off on the wrong path of that questioning process, don't we?
Yes, I think that happens. We had a huge challenge, obviously, in human medicine with COVID, and we certainly didn't get everything right. So there's no doubt about that. I think that we learned public health lessons have learned and will continue to be learned from that. But I think the journey is important, isn't it? And then to have that kind of critical analysis afterwards and think about, okay, what would we do differently if this happened? Because almost invariably there's going to be another major pandemic at some point. It's just a matter of time, isn't it? What it is, but
yeah, absolutely. I guess We're getting back to Mike saying that you're used to difficult questions, and Mike and I could have been texting each other, wondering whether to go down this route further, because there is something that may, a question that may get us into deeper water than perhaps we want to in this podcast. Mike, what do you think? Mike's shaking his head. You don't think we should go down that route? I think it might be interesting. I think
you're going to chicken out again, aren't you? You're going to chicken out and get me to ask the question.
You ask it better than me. That's the thing. You have more compassion and empathy.
You should always ask. You should always ask the unaskable questions. When I did forensic psychiatry for quite a long time, but a big chunk of my career is spent in the high secure prison system, and dealing with some of the kind of, I guess, the people that society doesn't want on the outside. If you're going to assess risk, then you have to ask the unaskable questions. Is what we was.
And okay. Is there a particular technique that you should use in asking these questions, Tracey? Because I bow to your superior clinical knowledge and experience here.
I think sometimes if you don't know how to say something, it's best to say, I don't really know how to say this, but I'm going to say it anyway.
Go on then, Mike.
Okay, I don't really know how to say this, but I'm going to say or ask this question anyway. Tracey, what's your favourite bread?
My favourite bread?
Well done, Mike. Compassionately asked. We're over that hurdle. Down to Tracey now.
Well, I don't know, because Tracey hasn't answered.
It's a difficult one, Lacey, because
it is difficult.
It is because there might be. I know it's got to be overall cranberry and cashew bread from the Tesco finest. Oh, I'm allowed to say Tesco. Probably not allowed to say Tesco.
No, the supermarkets are available.
Yeah. We've not had that one before, have we? That's an interesting one.
What is this bread?
It's one of their kind of, they do a whole range of about 10 different specialty breads, and it's one of the breads in there. And
cranberry and cashew.
Yes, it's really tasty.
Interesting. So, but particularly useful for hypoproteinemic ladies with cystitis. But,
yes. But actually, great with cheese.
Great with cheese. Great. Would you have that with salted butter or unsalted? Because you wouldn't want the salt with cranberries, but you'd want them with the cashews, wouldn't you? Or do you have it with jam?
I'd just have lightly salted and then some red onion marmalade or something.
Oh, caramelized.
Cheese.
Caramelized red onion.
Caramelized.
What cheese?
Oh, what cheese? Okay. I like the blue cheeses.
Blue cheese with cranberry, you'd be thinking more of a camembert, surely.
Yes, but the soft blue cheeses are really nice. So they go really well. They go really well.
Some dolce latte or rock.
Yeah, we have a little deli near us. I don't even know half the time what cheeses I'm eating. I just say, can I try some of that? And they give me it. And then,
Down to that. I'm gonna make a cranberry and cashew nut bread.
You must make one. Yes.
Mm-hmm.
Wow. There we go. So that's how you ask a difficult question then.
Brilliant. But you didn't mind us asking you.
I thought you were going to ask something really. You're going to ask about euthanasia of pets with special needs or something.
Oh, go on then. Tell us about that.
We can ask about that if that leads on from the biomedical ethics.
It does. Now, as a vet, we always get told euthanasia is not a welfare problem. For the pet, euthanasia is not a welfare problem. For the owner, it usually is a huge welfare problem. And one of the big problems we have as vets when we euthanize a pet, because it is the best thing to do in that situation, we have to then deal with the owner, and we do that to a greater or lesser extent. That some of us will refer the owner to a grievance, grieving or mourning. No, not grieving. Hopefully, our job properly, we won't need to do that.
A grievance proceeding.
So some sort of grieving counsellor or bereavement counsellor. Others of us will just say, sorry about your loss, off you go, and I'll send you a card with a packet of forget-me-nots in a week's time. I can't help feeling the best way is a gradual preparation.
If you have that opportunity, if you have that opportunity, I think it can be very sudden, or it can be incremental, in the same way that human death can be. It can be an anticipatory grieving over a long period of time if somebody has, for example, CA and widespread metastases. You know that you're going one way, and obviously the end of life teams with women who ride, although they're very amazing and good at what they do. But in A&E, you can have very sudden, as I say, where people's lives have changed in an instant. They've said goodbye to someone in the morning, and then they're at the bedside and they're dying in the evening. A very tragic, kind of sudden. I guess hopefully, if you've known them for a period of time, then I suppose you have a relationship that you can probably judge what they might need. If you've never met them before, it's that bit harder, isn't it? But I think the most important thing is that you listen to what they say, even if it's only for a few minutes, even if you've only got that time to just allow them to say what they want to say, if they want to say something. And some people may not, because we all deal with death differently. And the trouble with death is it resonates with the other deaths you've ever had, all the other losses. So it's not even as simple as the pet, is it? It's all very well saying it's not a pet welfare, the pet's problem, but it's so integral in that person's life.
Yeah, absolutely. And a number of times a pet dies, and the owner says, my dad went 3 months ago, and this all comes back, or gosh, my aunt had exactly the same thing. And you wish that you hadn't said what you'd said to lead up to that and given them the trigger. But I guess they're going to find that trigger anyway, aren't they? They're going to, in a way, they need to find some sort of pattern to it, because that's how we work through life, isn't it? We look at patterns, we look at ways of doing things that have happened that we can relate to, because we've already compartmentalized these a little bit. Is that right?
Yeah, so I think if somebody wants to talk about it, then we shouldn't be frightened of talking about death. I think we're not very good probably at talking to people about loss and death and disability and those things.
And that's come up a few times in veterinary ramblings, that I think as a culture we handle death very badly, and our way is to not talk about it and to hide it away. Other cultures may not embrace death, but embrace the idea that we can celebrate someone's life, we can celebrate a pet's life, we can acknowledge that they've gone, but think that actually that their contribution to our lives is still there. And we almost denigrate that, don't we, when we mourn someone's loss?
Yes, I think there's a real opportunity to explore the gift that the animal has given them, that their pet has given them, and the joyful memories. And it's almost, we do it with a wake in humans, don't we? But we don't have that really with pets. We don't really have that.
Some do.
Yeah, some do. I believe some of the pet cemeteries, don't they? And how many people, most people's experience would be that sadly, the journey to the vets, and you make the final decision with the vet, and you're left alone to before and after to say your goodbyes, and then you make a decision about where you want your animal to finally go to rest, whether they're going to be cremated or you're going to take them home, bury them, or whatever. But I think it's all quite sudden, and that maybe, but of course, a pet may be the only important thing in somebody's life. And I think when we were talking to Louise and we were first really exploring the Canis kind of information, and so many of the vets at that time were feeling that the only way forward really was euthanasia. That was just a huge, what for one lady, where that her pet was the only thing in her life that gave her meaning, and that she felt was important, or that was the reason she got up in the morning. And it's you have to look at every individual and their circumstances. And of course, you haven't got time as vets, have you?
For almost every vet, it's been something they picked up as they've gone along, and they've gone through situations they thought, that went okay, and others not. What's your take on that, Mike?
I'm blown away by the whole thing. I think, as you and I have discussed this at length, the discussion of death. For me, I think with my experiences, and certainly some more of my more recent experiences out in nature and the wilderness, where one slip could prove fatal, I have more of I suppose, a laid back attitude about it, in that tomorrow is a gift. and you never know what is going to happen. As Tracey has said several times, we literally go about our lives routinely in the UK here, our so-called civilization, with not a thought, and we step off the curb, and we don't even think about it. And life is a fragile and precious thing, and we take it for granted, I feel, very often too much.
I think we do.
But that's come from me walking around in the Arctic. We are part of nature, just we pretend that we're not.
A few years back, I was lucky enough, I think, privileged enough, to be present at the death of a friend. And I'd been to the nursing home. His wife and daughter and son were there. And we were sitting around the bed, just chatting. And I noticed he'd stopped breathing. And I couldn't think what on earth we were talking about. But his wife just said, I was complaining about the shoes I bought. I was complaining about the shoes I bought, and he's died. How can I? What an awful thing to be discussing as he's dying. We were having a chat. He was part of that. He wasn't saying anything, but he was part of that routine part of life. And what was there anything more portentous that we should have been saying? Should we have all been quoting Shakespeare? Should we have been telling each other wonderful stories about what a great guy he was? You can't handle those things, can you? You can't plan them.
No, not at all. Not at all. It's that took a bit of a turn, didn't it?
It did a bit. and that's the danger that asking what your favourite bread will lead to.
There you go.
I suppose that's why we need to muscle into it.
That's all my fault. Okay, I want to turn us back.
The thing I would say though is you don't need to wait for that moment, do you? Because hopefully everything that really needs saying in your life, you should have said it already.
Absolutely.
Yeah.
And we should. Absolutely. You grasp, was it God's goldfish, isn't it? Carpe diem.
Yeah.
I think it's called goldfish. I use Google Translate.
Yeah. So on that note, tell your loved ones you love them next time you see them.
Yes, indeed.
Yes,
yeah.
Absolutely. And tell your bank manager you don't.
Yeah. Unless you want a mortgage.
Unless you want a mortgage. In which case, tell him or her you love.
Tell him everything.
or help with the overdraft. I don't. Where is this conversation going? I don't know. I think.
But my wife said to me the other day, she said, "Look, if I die tomorrow, would you remarry?" And I said, "No, I don't want to chat about this. Of course I wouldn't." She said, "I want to know. It would make me happy. Just tell me. Are you going to get remarried?" And I said, no, she's already married. And apparently that was the wrong answer.
Very good. I don't know. Tracey, earlier on, you mentioned a number of things, and it's interesting because there's been a thread that's run through our conversation here, which is almost that every day is a school day, and that there's always more than one way of looking at a particular problem. And that you also mentioned that your special needs dogs have encouraged you to look at this alternative way, or this different way of looking at things and problems. And I'm sure it can't just be problems, can it? They must bring some joy and love into your life.
There's more joy and love than there are problems. And if I overemphasize the challenges and the changes that you might have to make to your routine and to the environment and the financial, because there invariably will be some of those, but I think that is paid back 1,000-fold by what they've given to me. And I would now personally never not have one of my dogs with a special need of one sort or another, because they just are remarkable. They are remarkable. They are amazing. It's so sad that so many of them languish in shelters and rescues and are not adopted when they have so much to offer and so much that we can learn from. One of my dogs has to go to the vet very regularly. The practice where, I take her every time, they're just happy to see her because she loves life so much. And it's almost as if she compensates for the difficulties she experiences by being so kind to everyone around her and so appreciative of attention and so interested in everybody. It's as if she's just a sponge for that. Yeah, they're amazing. But I think they're not for everyone. They're not for everyone. And they definitely need... If you take one on, you should see it through. And so you do need to have enough support around you that, that you are able to have other people who can care for your pets if you're away, or kennels that will take that pet on. You don't want to be they're referred to as hero rescues or hero adopters. It's not about that, but you just want to be realistic about what you can cope with and what kind of help you'll need. And for some, the dogs will not require any additional resources to look after them, and it won't be life limiting. They will live a full, happy, normal life with the same ailments that any other animal might have, but others it will be. There will be ongoing costs, and you have to be prepared to meet them, don't you? If you take on the dogs with epilepsy, for example, it's going to be ongoing costs of medication. Some of the dogs with orthopedic issues may need hydrotherapy, they may need physiotherapy, they may need chiropractic, they may need all of those things. So it's just about being clear on what you're taking on, and that there's a whole wealth of support systems available for anybody who wants to take on a pet with special needs. And I think I didn't realise that when I started on that journey, and because I only discovered Tribal UK, for example, with really good groups for people with dogs who have a limb amputation, and afterwards, and there's a whole wealth of love, really, and in a world where sometimes we lack that. I think
we had this conversation several years ago.
Mike's had a succession of special needs dogs.
Yeah.
But the last one we were told, we will probably only live for a couple of years.
Yeah. Wait, they live forever, don't they?
Yeah, they do. 8 years later.
Yeah. It's like I took on a 14-year-old dog at the end of its life 3 years ago. But I guess one other thing I'd say is that people wanting to know whether that dog is right for them, or that cat or whatever is right for them, you should also chat to the vets.
Yes.
Chat to their local practice, maybe from the veterinary nurses or the vet that will be able to advise them both practically on costs and on likely ongoing treatment, but also on what to expect from that vet.
Absolutely. They're your biggest ally, aren't you, vets and the veterinary nurses, who are interested, compassionate, understanding, knowledgeable. And I'm incredibly lucky that I have an amazing practice and with amazing vets and staff, because it's the admin staff as well. When you go in, from the very first time you step foot in there, you feel welcome, and you feel that you're, I guess people go into veterinary medicine for all sorts of different reasons, as they do in human medicine. But the vast majority of people, I think, come into it hopefully wanting to make a difference and wanting to care and wanting to nurture. And maybe that part of that is to feel good about ourselves. What's wrong with that? What is wrong with that? Then it's win-win, isn't it? You're helping someone else and you feel good. Fantastic.
I think so. And I go as far as to say, if your practice won't give you that advice, then that's not the practice for you.
No, change.
Go somewhere else.
We do advise people to check, because in our charities have now a number of dogs with special needs, and as I say, I'm involved in some groups where that they just deal with special needs dogs, and the advice is always go. When you're contemplating taking on that dog, go to your vets, give them all the information, tell them everything, show them the x-rays, show them the reports that we've already got, and judge by their interaction with you whether that's the right practice, whether that's the right vet.
They may not have all the answers at once, but it's how they deal with that. Whether they're interested enough to deal with that, or whether they just say, no, we wouldn't really be interested in finding out about your pet.
Yes. Or feel that don't get me wrong, I don't think that every life is a life worth living. No one would want to see an animal suffering in intractable pain. I think that there are absolute limits, but there are so many disorders and so many disabilities that do not cause pain and suffering. And for them to be seen as a burden or as a lesser being because they are different is a sad, I think it's a sad reflection of somebody's value system, really.
You said to me earlier on that if you've got a difficult question, you should just come out and ask it. Yeah, I'm not going to do that. I'm going to beat around the bush. I'm going to do this traditional English style for our American listeners. I wonder if you could summarise in, let's say, about a minute, some of the joy and the excitement that these special dogs bring to your life.
When you say a minute, are you talking of an exact minute?
I was wondering possibly whether it might be maybe perhaps okay if Tracey would take the 60-second CPD challenge, but I wasn't prepared to ask her directly. But yeah. So Tracey, are you up for the 60-second CPD challenge?
Got to be done.
It's got to be done. Okay. All right.
Yay.
Yes.
Okay. Tracey Turnbull, 60-second CPD on the joy and excitement that special dogs bring to your life, starting now.
Like most people, I came to adopt a dog with special needs by accident when nobody else wanted her or would take her on. And I was extremely worried, frightened, apprehensive, didn't know what I was taking on. And I should never have had those worries. My worries should just have been about how I should have not turned her into a complete diva. But she is, and since then I've gone on to help many dogs with special needs. Their spirit, their resilience, their hope, their forgiveness, their empathy to the emotions of humans is just incredible. And I have learned so much about myself. My children and my grandchildren have learned so much about that being different isn't about being having a lesser quality of life or being a lesser person or a lesser animal. You will treasure the memories forever, so get one.
And that's it. And that's perfect.
There we go. Right in on 1 minute.
Amazing.
Fantastic.
I have a special needs dog, and I did have a special needs cat and a special needs tortoise.
Amazing. I knew though. I knew you would. This is I could tell.
We have that look about us.
Yeah, you have certainly an aura about you that and compassion and understanding. I think can tell.
Oh dear.
It's all put on. We're not really.
I've gone out of my way to cultivate this hard macho image, and you
look. We're skinheads.
Yeah.
We're
Brucella. Yeah. Brucella.
Dogs. Can I ask about your dogs? What are
Mine's no longer with us, and what was wrong with Bongo? What was right with Bongo?
I've got a Bongo.
You've got a Bongo.
I've got a Bongo.
Yes. Right. Yes. I don't think anything was right with Bongo.
I think poor old Bongi, he was an RSPCA rescue. He was a collie, and when they took him away from the owner, he weighed, I think it was something like 3 or 4 kilos, which is almost a tenth of the weight. Yes. Not a tenth of the weight, but way underweight. His head didn't fit on his neck properly, and his spine at his hips didn't fit properly, and he was very wobbly, and he couldn't walk properly, and he had Tourette's, and I loved him.
Not the coprolalia form.
No.
Yeah. No, he did. That's exactly what he had.
Actually, he did.
Yeah. And periodically, as he was trying to make his way along, sort of wibble, wobble, wibble, wobble, he was like a catwalk model on steroids with crutches as he tried to lollop his way across the grass. And occasionally he would just, for no apparent reason, fall over. But we loved him, and I miss him desperately. So that's my Bongo.
So I have a Jake rather than a Bongo. And Jake is an indeterminate breed, could be a Shih Tzu cross, who is around 16 and a half. And I took him on during COVID, when his owner sadly was unable to cope with him anymore for health reasons. And Jake has 2 deformed forelimbs.
Okay.
One of which, at the age of 12 or 13, the owner came to see me to say, is there anything we can do? Because I've just taken him on. He's unable to use his right fore. And poor Jake, his forelimb was so curved that he was walking on the back of his wrist.
Okay.
So I operated and straightened his leg to as much as I could, so he can at least walk on part of his paw. And I had him to stay for the post-op care for 2 or 3 weeks because, again, the owner wasn't able to look after him. And the whole family fell in love with him during that time because he is so impossibly wrong mentally and physically that you can't help but feel sorry for him and love him. And then when the owner said, look, I can't manage him anymore, we thought, as I said, it'll be 6 months. We can look after him for 6 months. And 3 years on, he's still buggering on. And he's lovely. He's great. He's completely deaf, partially blind, can't walk more than 10 or 20 meters in a day because he gets very tired. But he loves being carried places and sniffing new air. He's wonderful. He's great.
So he didn't even come out and see me last time.
He sleeps hard these days. He sleeps hard.
But you can't describe to somebody who hasn't had one just what they give you or how they're different. It's intangible, isn't it? And
yeah, completely.
Yeah.
And I don't know how you get that across to people who haven't experienced it, other than advocating on behalf of them and hoping that some people will take the leap of faith.
Yeah, and in fact, my mother-in-law has a tripod cat. She lost her other cat at the grand old age of 15 or 16 and was looking for another one. And we had a stray that I'd had to amputate one of his legs. And she said initially, oh, no, I could never have a cat with 3. Oh, no, I can't. Because some people are revulsed at the thought of an amputation of them. And she came round to visit one day, and I happened to have the cat with us for the weekend. And I don't think she was wearing her glasses. She didn't quite notice for the first hour that this cat was sitting on a knee, that he only had 3 legs. And then I said, oh, this is Max, by the way. Max, not the cat with 3 legs. I said, yeah. One leg for every letter of his name. And she looked at him and said, he's lovely, I'll have him.
Oh.
And she's had him now for 7 years. So.
But you don't even notice it's really strange because when I've got 2 tripods and when I take them out and people say, oh, you've got 3 legs and what happened? There's always the questions. But it's really strange because it's almost now, it's almost, oh yeah, okay, yeah, because to me, they just are who they are. And I don't even see the disability. And I think that I only really realised that it's not just me, it's the whole family, because the grandchildren they were at school and my grandson, my oldest grandchild, and they were obviously doing a teaching session on disability. And so they showed them a cartoon, which was The Present. Have you seen it? And watch it. It's only a really short film. It's called The Present. And it's about a young lad his mum brings him home a box, and in the box is a puppy, and he's already really happy to see the puppy, and then the puppy kind of jumps out and he realizes the puppy's only got 3 legs, and he kicks the puppy away and doesn't want to play with it, but the puppy's just undaunted and full of joy in life and just continually. So in the end he thought, oh, okay, I'm going to play with you. Spoiler alert. Do you want to know the end? Yeah.
But the cartoon's called The Present, and it's very good.
So he gets up to walk to the door to play ball with this puppy that just won't give up. And you realise that he's an amputee, the little boy's an amputee. And
wow, gosh.
And my grandson then said, the teacher said, yes, and this is obviously there are lots of different people. Some people may have a disability that's visible. Some people may have a disability that's not visible. But we're all the same inside. And my grandson said, yeah. He said, I thought everybody had dogs with 3 legs. He's only young, but 3 legs because my nan's got 2. Yeah.
The leg extra.
And I think it's good for them to stare. It's good for them to ask questions. I encourage them when we take the dogs out for children to come and ask, because they will ask the unaskable questions, won't they? Children, they just.
Yeah, they will. It's normal to, and it's normal to have a curiosity that for some reason we tend to call a morbid curiosity. But actually, it's just a curiosity. How do things work? How does he do it? How does he cope?
Yeah.
The revulsion is interesting. There's lots of psychological kind of reasons why people may feel revulsed, but the probably at the root of it is the fear of what we don't know, isn't it? And it's about our own vulnerability. How would we feel? How would we function if we were in that situation? And but of course, how you actually would deal, it would be quite differently to how you would view it when you're not in that position.
That cartoon's called The Present, did you say?
The Present, yes. I'm sure it's The Present, yeah.
I mean, Julian's probably got a present for us, haven't you, Julian?
I have got a present. I've got a certificate.
What, a CPD certificate?
A CPD certificate.
Fantastic.
And it says, here we go, it says certificates to show the benefits of having a special needs dog.
Oh, that's awesome.
So there's Jake. Now he's particularly attractive with a feather stuck to his nose. I took that earlier today, but you can see his bent legs. Our previous cat, that was Jimmy there, and Jimmy was a female cat, and she had cerebellar hypoplasia and used to twitch quite a lot. Now there's another special needs cat I had. This is tarsal hypoplasia. This poor little cat had what we call Munchkin syndrome, which is very foreshort limbs. And in the middle there is a jaguar I saw at a zoo once that had special needs that we had created by captivating it. So this poor jaguar had stereotypic behavior. But there are other ones that we make that we don't normally think of as special educational needs. So there's a dog and there's a cat. And I've done nose amputations on for various reasons. And in both those cases, the owner, we had to counsel quite strongly beforehand because it has changed their facial appearance, which is a bigger problem than losing a limb, because our faces and our pets' faces are what make them our pet. These poor little critters had nasal tumours, and both went on to live their normal allotted lifespan after their noses were removed. And the owners forgot in both cases, and every other case I've dealt with, they forgot that the operation had been done, to the extent that people will come along and say, oh gosh, what happened to your dog? What? Where? Where's got no nose?
Yes.
Oh, no, that's right, I'd forgotten about it. The look doesn't make the pet, does it?
No. It's your relationship with them that's special.
Brilliant.
And Tracey, you've been very special by telling us all the reasons behind why we should have a special needs pet. And you thoroughly deserve that certificate for giving us an amazing 60-second CPD and a wonderful evening of learning about your life, travel through life, and why we should all have a special needs pet.
We definitely should.
Okay, in that case, if we could, it's probably time to start closing up, but I'm wondering, Tracey, if I could burden you once more and whether I could ask you to ask our audience a reflective question that perhaps summarises what we have been talking about this evening. Would that be possible?
Yes, definitely. I guess the question I would pose to your audience is, from everything that we've talked about tonight, has it made you contemplate or think about owning a pet with special needs?
Okay.
There we go. So everyone, think about it.
Yeah.
A lot of pets need rehoming.
Do.
And if the answer is yes, you
They
mentioned...
can come to me.
I was going to say, if the answer is yes, when our audience think about the question that you've just posed them so beautifully, you mentioned there are a number of support systems available to help them through that decision and ongoing. Are there any particular places you say, come to me, but I could see the floodgates opening for you there? Where should somebody go for more information about this?
Much as social media has its downsides, it has some really positive, there are some really positive aspects to it too. And I think if you're thinking about owning a dog or a cat, an animal with special needs, and you have an idea about what you think you might or could take on and are capable of giving the time to and the financial commitment, whatever it is, then go and look that up, because there will be groups just catering. So if you're interested in owning a deaf pet, if you're interested in owning a blind pet, if you're interested in owning a tripod, if you're interested in owning a paralysed dog, then just search it out and go on and just give you a reason for wanting to join, because they're often closed groups, and I think it's done for a reason, because you really do want it to be supportive. You really need the support, and so they're likely to be closed groups. But just say, I'm thinking about taking on or adopting or fostering, because that's a great way to start. Foster and see how you feel, see how much time and commitment you can give, and maybe have a few different pets with different needs before they go on into their forever home, and then read the posts that people are putting on, because you're going to see the good the good, the bad, the ugly. You're going to see everything, and ask questions on there. Let the group who usually are living that experience or have lived that experience, let them help you and guide you, because there really is a tremendous amount of support within the network of people who are owning and adopting or rescuing pets with special needs. It's very different from mainstream rescue, I think.
Fantastic. Fantastic. That's great advice. That's brilliant. Tracey Turnbull, thank you so much for sharing an insight into your life and the amazing work that you do. It's been an absolute privilege to talk with you this evening. And if you've enjoyed or have any questions for Tracey or Julian or myself, and you've enjoyed this evening's Veterinary Ramblings, please don't forget to like and share, and please subscribe, because it really does make a difference. Tracey Turnbull, thank you very much indeed. May your dog go with you.
Thank you.
May your dog go with you. Cheers.
Go with you.
Cheers.
It's been an absolute pleasure.
Cheers.
Thank you so much. Thank you for all you do.
Thank you. And what a great evening. Thank you so much.
Fabulous. Thank you very much indeed, Tracey.
Thank you.